And good evening, everyone. My name is Dr. Uchenna Onyani. Welcome to On the Go with Dr. O. We are here this evening because we are discussing the possibility of a vaccine card. This is a subject that has been brought up over the last few weeks, and we wanted to have a discussion about the pros and cons with regards to such a card if it were to come up. Tonight, we have our guest, Samaya Simone, along with Ms. Suzanne Roganci, and we're going to have a conversation about what this could mean for not just residents of New Jersey, but residents of the country as a whole. So what we'll do first, we'll have each guest just kind of introduce themselves and let us know a little bit about themselves and their background. We drew straws at the beginning of the show, and Miss Suzanne Roganci won, so she'll go first, and then we'll
Oh
go
gosh.
a moment after that.
Hello, my name is Suzanne Roganci. I've lived in the Maplewood South Orange area for 35 years. I'm an interior designer. 4 children went through the school system, and that's what I am.
Wonderful. Thank you for that. Next, we'll have Ms. Samaya Simone.
My name is Samaya Simone, and I am an advocate for informed consent, co-founder of My Black Health, which is an organization we founded to advocate, to research Black health issues in this country, and also to advocate for issues that are good for the Black community. I'm a homeschooling mom. I have 2 children, and basically I kind of just fell into this issue and became very passionate about it. So.
Wonderful, wonderful. Well, thank you very much, ladies, for that introduction. And, one of the reasons why, we have both of you on this evening is because, many shows are out right now discussing the pandemic. They have experts, they have people who are considered, at the top of their field. But what we haven't seen a lot of are just regular down-to-earth people. They may not have expertise in epidemiology, they may not be the biggest civil rights attorney in the country, but this affects the regular people. And I thought it would be best that we have people on who are, considered by society normal citizens, to get an opinion and have a discussion about what this means to you and how this affects not just you, but your family and your community. So what I'd like to do, I'd like to first find out, Suzanne, how do you feel about the prospect of a COVID-19 vaccine card being implemented?
I can see scenarios where it would make me feel comfortable, but I could see how it could be abused as well. But there's no doubt that if I was going to an event and I knew that everybody in there was vaccinated, I would have a really high degree of comfort, something we haven't had for over a year now. But I would be worried about abuses.
Interesting. Well, let's delve more into that for a couple of minutes as far as your comfort level with it. You say that you feel more comfortable. Why do you feel more comfortable, or why would you feel more comfortable with?
I would be more comfortable because vaccines and mask wearing and COVID itself has been so politicized. It's crazy that people aren't getting vaccinated. It's crazy that there hasn't been proper distribution, although it's getting better. So, and I'm in retail. I'm working with people every day where I wear masks, they wear masks. And I do feel to a degree that I'm at risk all the time because you just don't know. So to know that I wouldn't go into an environment and I knew everybody in that environment had 2 vaccines, I would not feel at risk.
I see. Very good. Thank you very much. Samaya, I ask you the same question. How do you feel about the prospect of the COVID-19 vaccine card being something that's implemented where people need to show that they've been vaccinated in order to move about?
I feel like because we're afraid and because many of us aren't aware of the history of humanity, we'll be rolling back. Like we'll be going back to a time when people didn't have freedom. And, you know, you'll hear people compare that to Nazi Germany when they had to show their papers in order to move around. And by they, I mean everybody. It just negatively impacted some people, right? But we don't have to go all the way to Germany. We can start right here in America. Because during slavery, you know, if you were Black, you had to have uh, paperwork in order to move about. If you were a slave, you had to prove why you were there and who owned you. And if you were free, you had to have your manumission papers, right, to prove that you were free. And I couldn't find any time in human history where a free society required paperwork to move about within your own country. I just couldn't find it. So it's a bad sign for me.
I see. So as far as the implementation of the cards, and you can correct me if I'm wrong, but it sounds like what you're saying is it is a slippery slope when it comes to civil liberties.
Absolutely, absolutely. And when you look at these regimes that institute this, including, I left out apartheid South Africa. That's what they did. They, you know, Black people over there had to have passport. They called it passbooks.
Hmm.
And, you know, they weren't allowed to go certain places. So basically, you know, regimes like that, one of the first things they try to do is restrict travel, restrict how people are able to move. And they always use fear. It's fear of this group of people, it's fear of disease, it's fear of something, right? But the problem is, when you look at the struggles that these people had to do, including my people, to have freedom here in America, right? And we're still struggling, right? It's easy to lose freedom. You could give it up just like that, but it will take, you know, it took us hundreds of years, right? Apartheid South Africa, I mean, so many people had to die to get where they are now, and they're still struggling. You know, when you look at what happened in Germany, we look from outside and we think, oh my God, how could the German people allow that to happen, right? It's not that hard when you're afraid, you know? And so there are people on this planet, and evil does exist. There are people on this planet that understand the power of fear. So we have to be very careful, because any atrocity that happened in human history, any atrocity, you know, there's a couple of things that's missing. And that's informed consent. That's why I'm an advocate for informed consent. It's important to understand fully what it is that medical treatment that you're taking in. And it's important to be able to say no. If you don't have those two things, then you are not free.
Understood. Now, Suzanne, you mentioned earlier that you thought it was crazy that people aren't getting vaccinations. Now, obviously, there's been a very strong campaign since the vaccines were brought out to try to get as many people vaccinated. Why do you think it would be crazy for people not to be vaccinated?
I think that this is different, right? I mean, we have over 500,000 people dead, right? And if we say that there are 4 people directly connected to each of those people, we've got 2 million people impacted directly by this disease. And it's the only time in our history that I know of, and I'm pretty good with history, where a disease was politicized. So we're not talking about Tuskegee Airmen, and are there abuses and atrocities? And I think it's so easy to conflate things, right? We're not living in brown shirt. Had you asked me a couple of years ago, I'd say differently, but we're not in brown shirt Nazi Germany. Now, anything can be used to do anything. This is true. And if this issue had not been politicized, wearing masks and COVID and vaccine and no vaccine, if we didn't have the seeds of anti-vaxxers in our society right now, we wouldn't be talking about an ID card. And that's just a fact. People would just be going to get their vaccines, as they did for typhoid, as they did for polio, as they did when I was a little kid for measles, mumps, and rubella. It was not politicized. We are living in really strange times. And so I think there has to be careful thought. And And all sides have to not conflate things. Every side should have concerns. And being a person who is white, I'm not going to have the same history. I know of it, but knowing of it and having it be part of your own history is different, right? So I get that that's white privilege. But the fact is, people have to get vaccinated to go to school. We don't make them have cards, but they do have to verify through their doctors that they have the vaccines, right? Or they can't go to public school, right? And we do that. And you have to have a license to operate a car. And we're okay with that. We've set really specific parameters of enforcement. Absolutely, there's a history of oppression in this country based on all sorts of things: ethnicity, skin color, whether you're an immigrant or not an immigrant, legal or illegal. That's all true. We have a history, and we can be rational and thoughtful about how we go about this. I don't think we should have a card that everywhere you go, you have to show it. I think that's ridiculous. I don't know the parameters, but I don't think having a card is a horrible thing. But I do think it needs a meaningful conversation between rational actors who are really wanting a solution that helps our society, not everybody grabbing their piece of the corner and not refusing to budge. I mean, we have to become a nation that talks to each other, even if we have differences, find our common ground. And it sounds so trite, but it is what we have to do. And we have to do it because we've lost over 500,000 people. It's not okay. And this is the only thing we can do to save ourselves. And from my understanding, absolutely not a doctor, if we don't reach a certain percentage of herd immunity, and there are variants constantly being produced, they may not render the vaccines we currently have ineffective.
Can I cut in for a second?
I have to, Suzanne, are you finished with your statement?
That's fine. Yes, absolutely.
Wonderful. Okay. Yes, please go ahead.
I just want to address a couple of things that you said about it being politicized. If it wasn't politicized, and if there weren't anti-vaxxers, I think you're looking at the symptoms and not the cause. The reason that there's this group that's been labeled anti-vaxxers, I don't believe that even exists. I think there are people who have actually started to dig into the science. And the reason they started to do that is because they went and vaccinated their kids just like everybody else, and their child got sick, right? So then they said, wait a minute, what's going on? And they started to study about it. And they're going up against an industry that has a lot of power. So they can hire people to make you think whatever they want you to think. But the fact is, the people they call anti-vaxxers is a symptom. We went from giving children 2 vaccines to now giving them 72 by the time they're 18. And they get more if they go to college. That's a lot of interferences with the immune system. We also gave the pharmaceutical industry liability. We took away their liability. So they no longer are responsible for the vaccines they produce. So if you get sick, you cannot sue them. So we're talking about the symptom.
I disagree. I think that science has shown over and over and over again that in regards to autism in particular, there is no link. There is no link between.
It never shows
that. That is true. It is true.
And there's no study that actually shows that there's no link.
There actually is. There was a study done over, I believe it was in Denmark, because Denmark was one of the only countries.
I actually read that study. I read it. It doesn't show that. There's
yes, it does.
No.
Well, I can. We'll look into that. We'll look into that.
Yes.
Yeah. You were saying something else, Suzanne. You were mentioning that there was something as far as vaccinations are concerned that as far as autism is concerned, you're saying that this particular study from Denmark shows that there is no correlation between the two, I think is the point you were trying to make.
There's been multiple studies.
One of the authors of that study is funded by the U.S. government.
There are multiple studies.
He can't even walk on U.S. soil.
A vast majority of doctors have said there is no causal link. But this is the problem. This is the problem in our society today. Whatever. The fact of the matter is, We don't have polio in this country today because of vaccines. We don't have measles, mumps, rubella, diphtheria. My sister had diphtheria. That's amazing that we don't have it. There are a lot of things we don't have to have.
Polio or diphtheria, but we have a growing autism rate that every year is growing at a point to a point.
And
there's curve keeps going. We're going to end up with a population of children who cannot take care of themselves. We have children who literally will never ever stop needing their parents, ever. Okay,
if this, then that does not always apply. There are children who are being diagnosed with autism more and more. Part of the reason is we know what it is. Many of those children back in the day were institutionalized for the thinking other things.
Absolutely,
we know more.
There was never any symptoms like that before, and I worked in.
Yes, there were. Yes, I grew up.
Let me have Suzanne finish her thought.
Okay.
The fact is, as medical science gets better and better, we know things that we didn't know before. Things we thought were one thing end up being another thing. There are always this is one thing I do hate about the times that we live in. Everyone wants things to be perfect. Things will never be perfect.
I agree.
There will always be people who get sick. There will always be people who do everything. You know, one of the biggest links to autism is fathers who are over 70 fathering children. There's a direct link there. That one has been scientifically proven. But it doesn't matter. There's never going to be 100% anything. But what we know is that the vaccine works, that herd immunity for this vaccine works, and we know that there's an extraordinarily high rate of infection, and that there's too much lethality. Is 500,000 people dead okay with you?
It's not okay with me. One person dead is not okay with me, but I don't get to decide who lives and who dies. But here's what I did do. I took the responsibility on my own health, and I actually did this research. The vaccine does not stop you from getting COVID. It does not stop you from transmitting COVID. Their own paperwork says this, right? So, you know, when we think that we're going to vaccinate and obliterate COVID, most of the states with the highest vaccination rates are the states that are now experiencing the spikes. How can we explain that? Because, you know, I mean, what's the explanation? I know so many people who've gotten vaccinated who are actually have been hospitalized for COVID. How do you explain that?
Well, ladies, that's a great question. But what we're going to do, I love the conversation, but we actually went a little bit over for our break. So we're going to take a break and we'll be right back with On the Go with Dr. O.
Chef Patty here. Why should you include avocados as part of your family's balanced diet? It's as simple as
1, 2, 3.
Number 1.
Avocados fill you up.
Avocados contain unsaturated fats, good fats your body needs to help with the absorption of key nutrients.
Me hungry right now.
Number 2.
Avocados are good for you.
Avocados are naturally cholesterol and sodium free, plus they contain nearly 20 vitamins and nutrients.
Me need vitamins and nutrients. And number 3, avocado delicious.
Try avocados in place of ingredients higher in saturated fat. Avocados taste great in sandwiches, salads, and even in baked goods like cookies.
Avocado cookies? This match made in heaven.
And welcome back to On the Go with Dr. O. We have been having a very spirited conversation about vaccine cards and the pros and cons of the possibility of implementing them in society here, both in New Jersey as well as probably or perhaps throughout the country. When we left, we were discussing why the COVID-19 vaccine was not necessarily considered as effective as it might have originally been promoted. Samaya was explaining to us that the COVID vaccine doesn't necessarily prevent people from either catching COVID, nor does it prevent people from spreading it. And during our break, I was having a conversation with our guests, and one of the things I mentioned to both Samaya and to Suzanne was how this particular topic seems to illustrate the type of division that we've been seeing throughout our country, and not just for the last several months and years, but over the last several decades. It feels like we've become much more polarized as a country. And one of the things that concerns us is when people are on one side or the other and dig their heels in and don't want to try to meet in the middle. It causes a lot of grief. It causes a lot of frustration, a lot of issues. And, I was curious as far as this particular issue, and Suzanne, I'll start with you. Do you think there's a middle ground? Do you think there's a possibility for us to see, all right, maybe we can implement something and take a few things out? Is that something that you see as a possibility?
Well, let me say this. I'm going to backtrack a little bit.
Mm-hmm.
What we have, we're a nation of a lot of people with a lot of different backgrounds and experiences. But there have been people who have taken those grievances and hammered them and hammered them and hammered them and hit them so often that people are just so, they light up like a fire real quick, because people intended to do what they've done. Because if we're a united people, if we are talking to each other, there is really nothing we can't do. And I mean it. This country has done bad things. It's done great things. And when we've done great things, we've done them together as a nation, embracing one another, embracing our differences and our commonalities. We haven't been doing that for 4 years. And that was a crescendo of since the 70s. Since Nixon, to be honest with you, since he was first in office. And it just crescendoed into the horrible past 4 years that we've just come out of. We have to find a way, but it's hard because people experience something and they know 5 or 6 or 2 dozen people that have had that. And that's micro data. Micro data tells us, macro data, it tells us nothing. Or micro data. You have to have huge numbers to see a statistic, to understand a trend, to see how things affect each other. But when people go with all their personal experiences and it's not overlaid over macro data, which shows us what's happening overall, things can get conflated or misinterpreted. We can't go with anecdotal information all the time. We have to listen to one another and understand one another, but we have to also do it in the context of the macro data. Macro data matters.
I'm glad you brought that up, and I'll tell you why. Because we're living in a time of big data, and they can predict what bread you want to buy. Yet we have a passive collection system for vaccine injury. So if you get injured by a vaccine, maybe your injury will be reported, maybe it won't. I've spoken to so many medical professionals that did not know the VAERS system existed. So why is that? Why is that? Especially when we're rolling out a vaccine, 3 vaccines that are being used in the humankind for the first time, that they've taken about 20 something years to develop, yet it was killing the animals in trials, right? They were never successful. So now it was approved through an emergency use authorization, right? And we don't even know that this vaccine would have been approved had it gone the regular route, right? Because it was approved during an emergency under the guise that there was no other way to treat COVID, which is actually not true. There are doctors and hospitals right here in the United States that are not losing patients. So I think it's disgusting the amount of people that died that didn't have to die, because we have companies that care more about profit, and they have a lot of control in our government. So the doctors actually they're literally being censored, kicked off of Facebook, kicked off of YouTube, because they are, and the treatments are working. So, it's funny because Merck just announced that they're about to test a new treatment, right? And guess what it is? It's an anti-parasitic, anti-malarial drug. But this drug, they'll be able to charge a lot of money for, the few cents a treatment that ivermectin would have cost, or hydroxychloroquine, wouldn't make them rich, So we have to be a people who actually care about human life. And honestly, I think the polarization that you speak about, Suzanne, I think it's manipulation. I think that the powers that wish to remain, right, those people who want to be in power have found the secret that if they separate us and have us listening to different news outlets, they can give some information to this group and some information to that group, and then they can have you argue it out with each other, and you get nowhere and everybody loses. What we really need to do is actually look at the evidence, and we're not doing that. We're listening to our outlets, right? But I listen to all outlets, and the reason I do that is because it occurred to me that they're all saying different stuff. And that's a problem. That's where the polarization is coming from. I think it's deliberate.
So I have a
Can I say something?
You want to respond? Because I want to make sure we have enough time. Go ahead.
So here's what I want to say, as clearly as I can say. Not all outlets are saying the truth. So they're not all equal.
You're right.
Let's disabuse everyone of that notion. And let me do this. We can meet. Here's the ground where you and I can meet. You want every single reaction recorded. I think that's a good thing.
Absolutely.
I think that can happen. And I don't see that. That's not.
Why isn't it happening?
But wait, who cares?
We should know.
Why?
We should both be demanding that happen.
But wait.
We're injecting something that has never been used before in humanity.
May I finish?
Go ahead. Finish your point, and then because we're running out of time, so I'll let you finish your point, and then I'll jump
very quickly. The fact is, some of the things you want, let's do them. Let's not get lost in fighting. Let me finish. Let's not get lost in why it wasn't, whatever. Who cares? This is an opportunity. And when every disaster is an opportunity, there's an opportunity here to do things in a way we haven't done them before. If you feel that there's not enough documentation of reactions to vaccine, perfect. Put that in the soup. There's lots of things we can do to address your concerns. But we do have to stick to the science, and we have to stick to the macro science. And if we constantly think that everybody has an agenda, if we're super paranoid, I don't think we get anywhere. Some paranoia is necessary, is required, but we can't go deep into it. It will always be a wall preventing us from getting to one another.
But wait a minute.
Absolutely. Now, hang on. What I would want to say is, because we are running out of time now, I want to make sure that everyone watching understands that while we are discussing the vaccine, the concern that we have is the card that they might be implementing, and whether or not is this a violation of civil liberties. Because I know, Suzanne, you mentioned in the first segment that this is something, as far as vaccinations, that was mandatory for school, and that's why
it is.
Correct.
You can't go to public school.
But with that being said, the COVID-19 vaccine is not mandatory. So if that's the case, if it's not mandatory, I think the question is this a violation of civil liberties, asking people to have a card for something that's not mandatory?
Absolutely.
And then on top of that, not only is this a violation of civil liberties, are we now heading down a slippery slope where once we allow this to happen, could there be more violations that might happen? Unfortunately, and I hate to do this because it's such a phenomenal conversation. We have run out of time. I can't believe that, the time is already up, but this is a discussion that I think we need to continue. And I would like to do another show with both of you because I don't think we've even really delved into what needs to be discussed fully. So, but I do want to thank both of you for being on this evening. You guys did a phenomenal job. Thank you so much, Suzanne, Samaya, you guys did a great job.
Maya, thank you for being here today.
Absolutely. Thank you so much. You have been on the go with Dr. O. We hope to see you guys for our next episode. Thank you so much for joining us for this episode. Y'all take care of yourselves. God bless and good night.
Thank you. Bye-bye.